Hi, I'm Dr. Jaimee Morgan. I'm in private practice in Salt Lake City, and I'm going to share some pearls with you today on Vit-l-escence composite. Now you may be asking yourself, well, in this world where everybody's so hip on porcelain, why should I even consider composite? Well, first of all, it's conservative. Second of all, it's very profitable when done in a time-efficient manner, and it certainly is considered an ideal restorative material. In aesthetics, there's two basic elements. There's shape and there's color. Shape is easily identified and we can reproduce it in detail. It's color that generally catches us off guard because not only are we dealing with hue, chroma, and value, but we're also dealing with opalescence and fluorescence. And prior to the introduction of Vit-l-escence, those two terms, opalescence and fluorescence, were never spoken in the same sentence as composite. So it truly was a breakthrough technology in composite resins. Now when we look at the color of a tooth, basically that's the interrelationship of dentin and enamel under light during the reflection and refraction processes. We can identify the basic hue of a tooth first, and those are your Vita shades A through D. But that basic hue comes from all the different chromas on the surface of the tooth. So if we look at a natural tooth, what we generally see is a darker band at the gingival margin, or at the gingival 1/3. And as we go from the gingival to the incisal, the tooth gets lighter and gets more translucent. Now, you might ask yourself, is that because the dentin is changing colors? Is it because the enamel is changing colors? Well, this is what we found out, is that if you extract a tooth and you slice it down the center and you look inside, it's not so much that the enamel or the dentin changes colors from gingival to incisal, it's more about the exchange in thickness between the dentin and the enamel. So at the gingival 1/3, the enamel is very thin, the dentin's very thick, so you get this nice warm saturation of color coming right through that very thin enamel. Hence, it's darker. And as we go towards the incisal edge, what happens? The dentin gets thinner, the enamel gets thicker, and so the tooth gets lighter, and then in the incisal 1/3, there's barely any dentin, if any at all, and so we have all enamel there, or primarily enamel, which means that we're going to have translucency. If we do our traditional method of shade matching, we would normally go to the adjacent intact tooth and we would get the average shade. We'd pop our shade tab up there, and that would be the shade that we would base our choices on what we're going to use in composite. But there's a much easier way and a much more predictable method to get the shade just right every time. Number one, if you have exposed dentin, take your shade tab up to the exposed dentin. That's your dentin shade. So you're not having to plug into any equations to figure out some magical shade. It's there for you. The tooth is going to be your guide. Also, in regards to how thick that layer is going to be, look at the DEJ. Where the enamel starts, that's where your dentin ends. So it's not a matter of somebody giving you a recipe on how thick or how thin each layer needs to be. The tooth will be your guide, and that way you can be assured that every time you go to do a composite resin, you can get a perfect match every time. Now, insofar as the enamel shades, because in these what I call super systems, and Vit-l-escence being the first of those, of that breed of microhybrids, there's so many enamel shades to choose from that it can be puzzling, it can be overwhelming, and although it's fun to have 34 shades in a system, what we need to do is narrow it down to the workhorse shades, those shades that we're going to be using on a regular basis. In Vit-l-escence, I've used it for as long as it's been out in the United States. As long as I've used it, we have been able to identify the workhorses in the enamel shades. First of all, the basic enamel shades are Pearl Frost, Pearl Neutral, Pearl Amber, and Pearl Smoke. In our practice, we've narrowed it down to 2. So we're using quite a bit of Pearl Frost for our patients who have bleached their teeth and Pearl Neutral for those who have not, because both of them are very chameleon-like. Your Pearl Frost is a very white enamel with no warmth into it, and then your Pearl Neutral has a slight hint of warmth, so it's going to work with your non-bleach shades. Even on our bleached patients, it's quite interesting. If you look at a class 4 fracture where there's exposed dentin, you'll find that that dentin is still very much in the A2, A1 shade range. And so when we're matching a bleached tooth, we want to take that into consideration and make sure that we replace the dentin core with the appropriate shade of dentin. So all you have to do, if you have the exposed dentin, even on a bleached patient, pop that shade tab up there because it's going to surprise you. And then of course, on those bleached patients, we are going to be using the Pearl Frost. Now, when we talk about fluorescence and opalescence, like I said, those are new terms to be spoken with composite resins. The fluorescence in the composite mimics or matches the fluorescence that's found in natural dentin. Now, fluorescence is extremely important every time your patients walk out in the sunlight. If you are using a composite that does not have that fluorescence of a natural tooth, there's going to be a shade discrepancy. So it doesn't matter how much you spend on new lighting or appropriate lighting as it's deemed in your office, if you don't have fluorescence in the composite, it's not going to match the minute your patients go out into the sun. If we look at traditional composites up against a natural tooth, what we find is that there is certainly a huge shade discrepancy because of that lack of fluorescence. And then when we look at a Vit-l-escence tooth, or one that's a tooth that's been fabricated entirely out of Vit-l-escence, and in comparison to a natural tooth, what we find is that they're identical. And so again, they went the extra mile to get us what we needed in our composites so that we could get beautiful results for our patients. Now, dentin is fluorescent, enamel on the other hand is opalescent, which is another word for translucency. In the past, our only way to